Hello, good morning and welcome. I'm Tamsin Rose, the Senior Fellow for Health at Friends of Europe, and I'm your moderator for this webinar called Living with Spinal Muscular Atrophy, SMA, Spotlight on the Policy and Access Environment in Europe. And I'm delighted to be inviting several experts to be sharing their views with you this morning. But a webinar is an exchange and a dialogue, and you can engage with us by putting your questions and comments in the chat, and you'll find that on the bottom right of your screen. Just to let you know, this event is being recorded. It's being recorded for reporting purposes, and we may use parts of it for social media. The recording will be shared with all registered participants, so you'll have a chance to use this material and look at it at later dates. Let me get started today, and I have great pleasure in introducing our keynote speaker from the European Parliament. This is an MEP, Mr. Stelios Kimporopoulos. He's a member of the European Parliament from Greece and the EPP Group. We're delighted to have you with us here, Stelios. Please, the floor is yours.
Thank you very much, Ms. Rose. It's my great pleasure to be here with you to this event which focuses on living with SMA, and I have been given the opportunity to be a part of it. Dear coordinators and participants, I'm certain that all of the experts on SMA and the patients' organizations will present to us all of the efforts made across Europe that have highly contributed to the fact that most European citizens have now access to treatments for SMA, as it's obvious in the third Policy and Access Tracker. As you may already know, I'm a supporter of a newborn screening for SMA, and I'm fighting to create a common mandatory list of newborn screening for rare diseases in the EU, so that newborns affected by SMA will be treated early enough in order to have the best outcome. However, living with SMA myself is much more than being a rare patient. Having SMA in most cases means that someone is a quadriplegic child or adult, a child that needs to grow up in a family, attend the mainstream school of its neighbor, play and socialize in its community, as well as for the adults. After we take our medication, we have to face the real world, take the real bus to go to our real jobs, make real friends, and start a real family. My point is that living conditions affect the quality of the patient's life more than the condition of one's health. I can understand that the field of interest of health experts is the treatments. What I really cannot understand is why all of the patients' organizations haven't added data to the policy to demonstrate the real living conditions of their members. I wonder how many children with SMA live in institutions, how many attend the mainstream schools, how many are involved in extracurricular activities, how many adults have a university degree, how many of them are working, how many live independent or have already created a family. You may think that kind of statistics are already available for disabled people in general, in every European country, but SMA people share some unique attributes. Our physical impairment requires a high degree of everyday support. Children are affected and need families that are able and willing to provide that support, while the enforcement of the state, of course. Our intelligence is not affected in any way, so we have to get educated, we have to work, we have to represent ourselves and our younger fellow SMA children in patient organizations. Also, our sexuality is not affected, and I haven't seen any patients organization addressing any of these important issues. I think it is a great opportunity to achieve all the above with the European Health Union and the new pharmaceutical strategy for Europe. On the one hand, we need a healthcare system that can accumulate the knowledge for patients and associations and the know-how of all these years on SMA treatments and policies. On the other hand, we need the pharmaceutical strategy for Europe that aims to ensure Europe's supply of safe and affordable medicines to meet patients' needs and support the European pharmaceutical industry to remain an innovator and world leader. My goal is to show and explain to my colleagues in the European Parliament how to create a new and effective approach in SMA policies. Finally, I would like to remind you the phrase of the President, Mrs. Ursula von der Leyen, that I totally agree. We cannot wait for the end of the pandemic to repair and prepare for the future. We will build the foundations of a stronger European Health Union in which 27 countries work together to detect, prepare, and respond collectively. The event is a nice occasion to change our perspective and promote the self-advocacy. Thank you for your attention, and thank you for the invitation to be here with you.
Thank you very much, Stelios. And I like the fact that you encourage us to look beyond just issues of treatment, but to look at quality of life and all aspects of people's lives as children and adults, including their families, their relationships, their sexuality, their economic opportunities. So you've really given us a big vision, a bold vision of what quality of life could look like for SMA patients. I'm now going to introduce two people who will present to us the new white paper on assessing the policy and access environment across European countries for SMA patients. And first I'm going to bring in Dr. Nicole Gussett, who is the president of SMA Europe. And then we'll also bring in Stephen Kelly, who is the vice president for life sciences at Charles River Associates, who helped to put together this report. And this report, I think, is really setting out the baseline. For the first time, we've brought all of these elements together because Stelios said, why don't we have the data? We need to understand how many children, how many families are affected, and then what impact it has on their lives. And this report is a first attempt to put this information in one place because the basics we all know in policy, what gets measured is what gets done. So this is a first contribution to a conversation about improving quality of life and health outcomes for SMA patients. Let me start by inviting Nicole to tell us, can you please explain for the audience, if they're not specialists, what SMA is?
Yes, thank you, Tasmin. SMA is a progressive neuromuscular disease, and it is typically diagnosed in children and causes muscles to weaken and deteriorate. And this can impact important development milestones, as well as everyday activities such as walking and eating. But to complement this rather technical definition of SMA, I would like to share a part of my story with you. I bring with me, on the one hand, the perspective of a trained patient expert, but also I'm the mother of two children, and my firstborn, Victoria, was diagnosed with SMA, spinal muscular atrophy, in 2011. So I know from first-hand experience how what we are talking today and what we were studying in this project is actually impacting the lives of those with SMA. And after an emotionally challenging way to my daughter's diagnosis, the day we received her diagnosis, my own world was breaking apart. It was despair, loss, hopelessness, but also lots of love. And SMA, these three letters were changing my life forever. I felt like I was drowning in an ocean, but my little daughter back then was my anchor, and in her I found the strength to adapt to my new life and to move on. But SMA is a merciless beast, especially without treatment. As soon as you adapt to a situation, it attacks and you need to readapt. It's a high psychological challenge for parents, but also for those living with SMA themselves. And living with SMA means continuous bereavement work. You fear loss, and every cold, every infection can potentially be life-threatening.
Thank you, Nicole, for sharing your story and explaining just what the impact is on the quality of life of the families and the emotional impact of just how challenging it can be, but also reminding us of the love and the joy that can still exist, even though you have this constant challenge to deal with. So now let's move a little bit towards this, the project that we're going to be talking about, the white paper. Tell me why SMA Europe was so interested in participating in this project and the Policy and Access Tracker. What difference do you think it would make?
Let me first thank to all those who have contributed to this amazing project. It's SMA Europe volunteers, it's our secretariat, our member organizations, but also, of course, the CRA team and Biogen. So SMA Europe, just to explain you very briefly, is a European umbrella patient organization. And united, we actually want to create a better world for all those affected by SMA. And we also want to improve access to diagnosis, optimal treatment and care for all patients in Europe. And in a pan-European patient expectation survey back in 2019, we actually saw that data confirmed our suspicions. So access to treatment in SMA varies a lot across different European countries, but also among SMA subpopulation. And this is still true. And this fact actually caused and still causing enormous distress in our community. Because, I mean, how would you feel if you know that there is a treatment that can stabilize your child, a treatment that can stabilize yourself, a treatment that can potentially save even the life of your child, and you cannot access it? It's just horrible for families in Europe, but of course also around the globe. And in SMA Europe, we know and we acknowledge that access to treatment is a complex construct. We know that data-driven approaches will help us and all the other stakeholders to unravel the existing challenges and hurdles in the pathway to access to medicines, but also to care. And we know that only together with other stakeholders, we can overcome these challenges. We can systematically collect the data needed, and we can drive change on a political level. So I agree with what Tasmin said in the beginning. The outcome of this project here represents a first step into that direction. It's a basis on which we all can start working on, and SMA Europe is certainly committed to complement this also in future.
Thank you, Nicole. Obviously, this is of key importance to the patient community, but can I ask you just to take us through some of the key elements in the white paper and indicate to us the special areas where the patient voice was so important and their messages come through?
Yes, I can do that, and I have some slides to illustrate this. So in this project, we have looked into the policy and access landscape for people living with SMA across 23 European countries, compared how they are performing on each of the different priority areas we have set. We highlighted the key challenges across these areas, assessed and called out best practices, and developed policy recommendations that now can be used to advocate for change with policymakers. Next slide. This study actually identified 5 areas, you can see them here in the slide, that are important to assess the environment surrounding SMA. Namely, these are political leadership and policy, healthcare system preparedness, diagnosis, then access pathways, and access to treatment and care. On the next slide, you actually see results from our study, and you see how, in a way, frighteningly heterogeneous this picture is across Europe. It's for me, it was really hard to see and also to accept that this picture is still that fragmented. And I would really want to highlight here, as you see the table now in front of you, and here you see dots. It's dots in a table. It's green dots, it's yellow dots, it's red dots. In other reports, you see numbers in the statistics. But we always really have to keep in mind and be very well aware that in reality, each dot that is not green here on this list is impacting people out there negatively. Each dot that is yellow or red is causing despair, hopelessness in people, in families who exactly know that there are green dots in other countries in Europe. And yeah,
Thank you.
I think, yeah, Tasmin, please.
Thanks, Nicole. I was just going to remind everyone that they can find that really interesting graph on the website smatracker.eu. So if people want to go and look specifically about their country and follow it, there is an opportunity, because it's hard to read on screen like that, and we know that people will want to be able to look at it and digest it. So thank you, Nicole, for setting that out for us and indicating that, yes, it looks like colours on a map, but every single colour behind that is hundreds and thousands of patients and their families who want to have a better quality of life. And there you can see on screen the link to the report, and it's an interactive website, so you'll be able to go in and have a look at the specific country you're living in and to see whether it's green, yellow or red. And obviously the point of having all of this is to make sure that we achieve better results. So thank you to Nicole. Let me now bring up Stephen Kelly from Charles River Associates, because you were involved in helping to try and put this data together in a picture. Let me ask you, building on what Nicole has just said, tell me more about some of the specific areas, and particularly the issue of health system preparedness and access.
Thank you, Tamsin, and thank you, Nicole. It's a pleasure to be here today and to give you some more information on the information and the background that went into building this very comprehensive tracker. And these 2 important policy areas that you've highlighted, the healthcare system preparedness really sets the foundation for achieving optimal care. And the second, for the access pathways, ensures fast access to treatment. So starting with the healthcare system preparedness, we covered 3 metrics in this topic. Firstly, the epidemiology estimates that is so important to provide the basis for short and long-term planning. The availability of a national SMA patient registry that can ensure the healthcare system has visibility on the number of patients with SMA. And lastly, the infrastructure with regards to the assistance of centres of excellence and networks of care to ensure all patients have good physical access to treatment centres. So overall, this metric on healthcare system preparedness gives an overall goal to ensure the availability of patient-level data and enable access to centres of excellence. This is vital as SMA requires multidisciplinary care which in turn requires coordination both at the national and international level to avoid those disparity in care between patients. A couple of positive examples from the tracker here included the European reference networks, allowing information sharing across countries and facilitating that international collaboration. Centralized registries through Treat NMD is a fantastic example of an international network having positive impact across many of the countries in scope. And lastly, countries that have a comprehensive and easily accessible national network, such as Phonimus in France, consisting of 6 coordinating centres working in collaboration, was a great example of achieving a green dot on that score. Moving on to the access pathways, we covered 2 metrics in this policy area. So firstly, looking at post-marketing authorization, early access pathways can ensure patient access to treatments as soon as regulatory approval is granted and the product is deemed safe and effective. And secondly, having specialized reimbursement and HTA pathways that are tailored for the value of rare diseases and recognize the value in national assessments is fundamental. These are absolutely fundamental goals, as in countries where treatments for SMA have been approved at the regulatory level but not reimbursed, patients diagnosed with SMA can face long delays before gaining access to treatments that may be available in other European countries. A few countries in the tracker have really adapted their approach here and allowed additional considerations of elements specific to rare diseases in their national assessments. And this has enabled accelerated approval, and that's possible in several countries to get access to new treatments, but we're still seeing a significant level of variability, particularly in the uptake and the access to treatments.
Thank you, Steve. Can you tell us a little bit more about how you developed the white paper and the national trackers? Did you encounter difficulties or challenges in finding the data, accessing it, and then putting it together across the 23 countries? Because our health data system is notoriously fragmented, and the Commission's got big plans for a unified European health data space. But until we've got that, how did you put together the data from the different countries?
I'm sure, as you can imagine, this was a really challenging and a massive endeavour that has taken us, the best part of a year to complete. Collecting this information on 11 metrics across 5 policy areas across 23 countries was very challenging. There was significant heterogeneity and variability in the level and the ease of access to this information. We have received great support from SMA Europe members and also Biogen colleagues from each of the markets in scope. However, every piece of information and every insight that's been captured has been confirmed and validated with public domain information. This is critical to ensure the standardization and the fairness and the accuracy of the data that's represented in those green, amber, and red dots. As you can imagine, not only collecting that information was challenging, but being able to actually visualize that information in a user-friendly, easily digestible and impactful way has been really important. So the website provides access to both a white paper and a tracker. The white paper provides an executive summary of all of the information, as well as a deep dive into each country, and gives the information specific to each of those countries. And the tracker allows a high level visual, as you've seen with the dashboard, but also a level of interactivity where you're able to click on and deep dive into the specific information within your country. Overall, it's been a significant undertaking, and the tracker shows significant progress has been made over the last few years. from a range of stakeholders, but there is still room for improvement. And now we've gone to this level of effort to collect this data and this information. We are hopeful that this will maintain the momentum going forward and encourage the actions to be based upon the information collected.
Thank you very much, Steve. And we put up on the screen there again the link so people could see the website, because we do encourage them to go and have a look. You've spent a year collecting the data and putting it together and making this comparable process. So it's an opportunity for everyone to go in and have a look at it. Nicole, my final question to you is, now that this data has been put together and we've got this report and it's hopefully now going to be in front of policymakers, how do you think this white paper could be useful for driving policy change at EU level?
Okay, so in this project, we have formulated policy asks for each of the areas, and it's a result of the study, because of course we did not only want to collect data, but we also want to start change or initiate change. And I think all of these asks are equally important, and you have them now on the screen, and all of them are part of a clockwork. And missing or non-functioning parts will, of course, result that the clock is not working, or it will display not the correct time. So we need all of them, and perhaps even more. But nevertheless, for today, I would like to highlight two asks in particular, as they are linked quite closely to what was the original motivation of SMA Europe to become active in this area. And this is: access provisions should be available to support fast patient access to SMA treatment, and reimbursement pathway should consider the specifics of rare disease products to fully capture the value they deliver to rare disease patients and their carers. And secondly, treatment and care approaches should ensure equal access for all people living with SMA and their carers. And for now, I would like to speak about value and access a bit more, also from our perspective. And I think value for neuromuscular disease and also in SMA, it's simplistically defined by motor skill, because also it's where we have the validated scales, the measurements, and this defines eventually also what the primary outcomes are in the clinical trial setting. And this setting of primary outcomes in clinical trials indirectly also define where a value of a treatment lies. But certainly, and we heard it today already, people are much more than their motor skills.